Hi, so I'm Helen Steed. I'm a consultant gastroenterologist at the Royal Wolverhampton NHS Trust. We were part of a team with colleagues in Leeds and London and at the University of Wolverhampton looking into women's lived experiences with inflammatory bowel disease while they were going through their pregnancy journey. That was really focusing on the stages of it, so thinking about becoming pregnant, being pregnant afterwards, and then for women who perhaps decide that they don't want children or who aren't able to have children, unfortunately. My role in that was to recruit patients into the research study where we interviewed them in depth about their experiences and then analysed the work, and we came up with the results. Part of the project on this occasion was to develop something that would be patient-facing, if you like, after the results. And so typically when you undertake a research project, you write a paper, you publish it in a journal, you might present it at a kind of medical or scientific meeting. And yes, there are absolutely patients that engaged with that side of it and read it and really want to know and have that level of knowledge. But there are other people that will never look at those, and I don't blame them. Some of them are really dry, and we're not probably the sort of most patient-friendly when we write work, because we write it for each other, and so it can be, you know, all the lay terms are all taken out of it. It was really a need to try and translate our findings back to women and their partners, because we felt that there were some positive messages that would be reassuring for them. Where the artists came in is that we've worked on a project before where artists represented women's lived experiences, and that went really well, and there were some excellent pieces produced, and there was sort of widespread engagement. So we wanted to repeat that. Where this project's a little bit different is we asked the artists to interpret the results for themselves. So we didn't want to tell them what the findings were. We've given them the transcripts for them to actually look at, and we've asked them to think what comes and stands out to them and what they think is important to reflect back.
I'm Dr. Sabrina Poiwal, and I'm the lead psychologist on this project. The psychology team are working on analysing the qualitative data that we have and using that analysis to help inform the artist's work. We know that patients often have experienced high level of pregnancy-related anxieties and worries. Despite the fact there's loads of really fantastic information out there. For example, Crohn and Colitis do incredibly patient-friendly information sheets. So it's not information that is lacking here, but I think it's perhaps the information available with the facts isn't that great at communicating to patients, telling them what they need to know. Now, art could be great because actually it speaks to patients and perhaps a bit more patient-relevant language.
So my name's Maggie Alif, I'm head of Wolverhampton School of Art. We were approached by psychology to start with, just to see if it was something that we'd be interested in, and I think it was a very tentative approach. I think they were a bit worried that the art school might be a bit snobby about working on something like this, but actually, of course, it's really key to our practice, not just training people with the skills, but actually thinking how you apply those skills to make a difference. I think we've got three wonderful pieces of work for starts. I think that what's clear is that the artists have managed to really take this incredibly complex material, this research, this knowledge of the clinicians and the condition itself and the sort of experiences of patients, and condense that into these really, I'm going to say simple because they are. I mean, obviously it's not simple, but they're really kind of simple, beautiful outcomes.
I'm Sorrel Milne. I'm an animation director based in London. My work focuses on the dissemination of scientific knowledge and research. I found the project overall really rewarding, and the process, particularly like the beginning of the process where I get to storyboard and I go through all the transcripts that Becky gave us, and going through those and creating all my visual ideas and just getting ink and my sketchbook and kind of learning through drawing and diving into that topic. I essentially read through the transcripts, and as I read through them, I process all the information by rewriting and drawing bits. do these big pages with ink or a pen, and like elements of it is drawn and elements of it is written, but you have like bits that I think are particularly important, they'll be in bigger font and stuff like that. And I basically kind of mind map across like loads and loads and loads of different pages. And in doing that, I can kind of pick out the more key elements and also think of ideas as I go. Like, it kind of enables me to generate visual ideas. And some of these are actually in the final film. When you have a chronic condition, you're often talking to so many different doctors and looking at so much different information online. It can get pretty intense and confusing. So the fact that this work is based off of transcripts and from doctors means that people can come to it for a bit of clarity. And I also wanted the film, and hopefully the film does represent a lot of different stories and people. I want people to feel like they're not alone in what they're going through.
Hi there, my name is Jessie Butcher. I'm a 24-year-old illustrator, animator, storyboard artist and writer. My practice is primarily on character animation, on very character-driven stories, very expressive, lots of emotion, and big, colourful worlds. The general theme on the project was that we were given a lot more freedom than I thought a project like this was going to give us. I thought it would be very clean medical text, very clean medical illustrations, which not my favorite, but doable. And then we're suddenly told we're kind of allowed to interpret it however we want. That gave me great freedom because, especially with a medical-based project, I think it's very important to involve emotions and personal feelings, because we've all had, well, most of us have had a medical experience that's been, maybe even a little traumatic. And yes, you can think about the physical side effects of all that, but then the mental side effects aren't always talked about. So I was thinking, this is great, because now not only can we discuss the medical side of things, we can also discuss the emotional and the mental side of things all in one, which I believe has made it a lot more engaging. One thing that would be really important to touch upon with this project is that when you give artists creative freedom, sometimes you'll get things that don't work, because it's a bit like you're splattering paint on a wall. Yeah, and sometimes you'll be like, all right, that doesn't work. But if you let someone splatter that paint, you're going to get something you never knew that you wanted. And I think that this project has really done that. They've allowed 3 artists to go a bit crazy in a room. And we've gone back and forth, and a few times they've been like, yeah, you've got to repaint that because that hasn't worked. But what they have got now is something they thought, well, we thought we were going to get it all in green, and you've painted the entire room pink, purple, blue with some glitter on it. And somehow it worked.
Hiya, I'm Rachel and I graduated from Wolverhampton University in 2019. I'm a creative communicator who practices in illustration and graphic design. The way in which I've interpreted such emotional stories is actually by trying to use colour, which is something I absolutely love, and kind of taking that in a way that can emotionally calm and relax these individuals. I think also in a way, in a lot of what I've done, although it appears very graphic, there's a lot of hand-rendered things in there that actually add that emotional touch and that human element. Going through the transcripts, there's obviously a lot of personal information. It was all very specific to each individual, and I think I really wanted to add that hand-rendered element to kind of subtly show that these are very individual stories, but also, this can be applied to any woman living with Crohn's and colitis. I just hope that it just at least gives them an insight as to what maybe is necessary for them to continue with family planning, especially with their disease. I think if they could just take my artwork and for it to maybe get thinking about some of these topics or subjects that we're talking about, and then hopefully use it as a tool and give them the confidence to then go to their doctor or their nurse to then be able to ask these questions and to maybe to feel a bit more supported in a way, that they've got this little booklet that they could then say, look, no, this is how I feel, this has made me think, I've got a question surrounding this. And I think in the booklet we've got a reflections page, and the idea of that is for them to just go through the images and go through the little bits of information, because it's not all there, but a lot of it is there, and just get them thinking. And I think when you're in a doctor's surgery, sometimes you forget maybe what you wanted to say, what you wanted to ask. So these reflection pages were just really important as a guide and just a little support for them to have the confidence to ask these questions that I guess are so personal about their own health and their children.
It's so impressive to see, and that the work kind of come together, and the concepts and the thought that have gone into it. I think the thing that surprised me is the way they've taken really different aspects of it. So there is overlap between the messaging that they're producing, but they have gone for quite different sort of representations. So the styles are incredibly different, and I think it's interesting how one artist is sort of almost sending a message from the healthcare professional's perspective. Another artist is really very much about the kind of the family feel and the patient's perspective outside of the healthcare setting, and then other artists has gone for something that's sort of a lot more factual in sort of addressing or kind of raising where women might want to look for more information. Where we know we struggle is that we do struggle to engage some people in research itself, and I don't think that we're great at representing those results back to patients and in a kind of patient-friendly manner that would make sense to the majority of people. And I think where we really thought that art could come into its own is creating that visual representation of just some of the key points that you're trying to get across. So I really think that art could be a way of sort of bridging that gap between research for academics and research being presented to the general public.